Hello everybody, welcome back to Nursing with Bonomi. I'm Nurse Nay, and today we're going to talk about common medications that you'll come across in long-term care. We got a request from KatRN over on Instagram requesting some information about commonly used medications that are in the nursing homes and some different things you might need to watch out for with those medications. So I wanted to go through a few of those for you guys. One of them is warfarin or Coumadin. So with this medication, blood has to be drawn usually 2 times a week, and it has to be within a certain level to be therapeutic. Prior to giving the medication, you should check to see what the last level was. It's called the INR, to make sure that it wasn't too high, because if that was the case, then you would need to make sure that the dosage was changed and that the doctor was made aware and so forth, because that can cause a lot of problems. Another consideration with Coumadin is that antibiotics, certain ones, can interfere with the levels. They can either make it higher or lower, so it's really important that the doctor, if he needs to prescribe an antibiotic for a UTI or something, make sure that he knows that the patient is on Coumadin, if applicable. Another big one is insulin. Is a high alert medication. It can cause a lot of problems if the wrong dosage is given. I think in a lot of hospitals you have to do the 2-nurse verification to make sure you've drawn up the correct amount of insulin. However, in the nursing home setting, that is completely not plausible when each nurse potentially has 5 or 6, or however many of their own blood sugars. It's just not possible. So you have to be really careful to make sure you are getting the correct dosage. Take that extra time to just double, triple check. Make sure you've drawn up the correct insulin. Make sure you've drawn up the correct patient's insulin. Usually in the medication cart you'll have several different insulins. Maybe you'll have Novolog, Humalog, Humulin, Lantus. I don't know, there's just so many different insulins. One thing to know with those insulin pens, do not ever use that on more than one patient. The insulin pens are single use only. That's it. Single use only. You do not use those for 2 different patients. Be careful when you're holding the insulin. Make sure that you're following the protocol and what the order says as regards to when to hold it. Sometimes I've had patients who are extremely brittle, and you're like, oh, their blood sugar is 70, I'm not giving them 6 units of insulin, even though it's routine. Guess what? Then you go check back later and they're like 250 or whatever. Sometimes patients' insulins are the way they are for a reason, and if you don't know the patient really well, I would recommend just kind of sticking to what's ordered or asking somebody, ask the doctor